Hey there, and welcome back to the channel. Today we're diving into a condition you've probably never heard of, unless it popped up on your blood test. It's called MGUS, short for monoclonal gammopathy of undetermined significance. Yeah, it's a mouthful, but don't worry, we're breaking it down in plain English. So what is MGUS? Imagine your immune system like a factory, constantly making antibodies to fight off infections. In MGUS, one little group of plasma cells starts doing its own thing, making an identical or monoclonal protein. This protein, called an M protein, shows up in your blood. By itself, it doesn't cause problems. But its presence is like a warning light on your dashboard. It means we should pay attention. Here's why. MGUS can over time lead to more serious conditions like multiple myeloma, lymphoma, or amyloidosis. That's why we don't treat MGUS right away, but we do keep a close eye on it. Now let's talk causes. We don't know the exact trigger, but some patterns stand out. MGUS becomes more common with age, especially after 50. It's more frequent in African Americans. It might run in families. And people with chronic immune stimulation, think frequent infections or autoimmune diseases, may be at higher risk. There are actually 3 different types of MGUS. Non-IgM MGUS, which is the most common and can progress to multiple myeloma. IgM MGUS, which may turn into Waldenstrom's macroglobulinemia. And light chain MGUS, where free light chains are floating around in your blood. So how do we even find MGUS? Usually by accident, during blood work for something totally unrelated. If a doctor sees something suspicious, they'll run a few key tests. SPEP and immunofixation to detect the M protein. Serum-free light chains, a complete blood count, calcium and kidney tests, and if things look borderline or high risk, maybe even a bone marrow biopsy. Once MGUS is confirmed, the next question is, what's the risk of it turning into something worse? It looks at 3 things. Is the M protein above 1.5 grams per deciliter? Is the antibody type something other than IgG? And is the free light chain ratio outside the normal range? The more of these boxes you check, the higher your risk. Monitoring is key. If you're low risk, you might just need a checkup once a year. If you're higher risk, your doctor may order labs every few months to stay on top of things. Now, here's something important. MGUS is not cancer. It doesn't need treatment, but it does need respect. Think of it like a quiet signal from your immune system saying, keep an eye on me. So what should you watch for? Unexplained fatigue, bone pain, unintentional weight loss, numbness or tingling, and more frequent infections. If you notice any of these, talk to your doctor. It could mean something's changing. Let's wrap this up. Most people never have symptoms, but regular follow-up is crucial to catching anything early. We've got more easy-to-digest medical content coming your way. And if you've got questions or want to share your story, drop it in the comments. I'd love to hear from you.